Dr. Paul Gibbs probably put it most directly at the Woodbridge Memorial Lecture, which is a lecture for veterinary medicine, when he said, it has been said that the earthquake that led to the Asian tsunami in 2004 literally rocked the Earth's rotation for a millisecond. In the 21st century, emerging zoonotic diseases have the potential to devastate the global human population, the effect of which could be to rock the Earth for a century or more. I was going to open with something like that, but I thought it'd be safer to attribute it to somebody else, but with the same impact, because we have to ask, is it exaggeration or is it not? And whether it is or is not, and I think that it is not, but it is our call to action to a concept that many of you have not thought very much about, probably, except intuitively have felt it, and that is one health and one medicine. Today I'm going to try a lot, and we'll leave time for discussion because there's so many experts in the room from so many different vantage points, and there's no reason to even ask me questions, but come to the microphone and be able to make statements and really continue to paint this portrait of one health, one medicine. I do want to mention what one health is, why in the world do we care about it, how I got interested, why in the world is the majority leader of the United States Senate worried about these bugs and drugs in preparation, a little bit about the history, where are we today, how well prepared are we, what about this bioterrorism, is it real, what we've learned and what we need to do. This whole modern One Health approach begins back in the 19th century. It goes way, way back, begins, at least in my mind, to the 19th century when the great German physician and pathologist Rudolf Virchow said, and he is, all of you remember, is the father of comparative medicine, cellular biology, and veterinary pathology, coming back to this sort of oneness of health. And as I put here, between animal and human medicine, said, there are no dividing lines, nor should there be. The object is different, but the experience obtained constitutes the basis of all medicine. And that really captures to me what this one medicine is all about. Zoonosis, a kind of a strange word that's out there, was defined by him, and the zoonosis really is a disease which is exchanged among animals, and it can be wild, it can be domestic, but can go to humans or from humans to animals. There's been a really disciplinary specialization between the veterinary profession and the medical profession, which has kept the two specialties apart. One medicine says it's time to bring those back together around a common body of knowledge, around a common specialization, given that all life really does come back to common roots. So when we're talking about one health, step away, or one medicine, step away and say conceptually it's this combination of experts studying animals and experts studying the human body. And the marriage. Now, in truth, One Health goes much, much further, and I'll imply this in just a little bit, and it extends very quickly into the environment and the relationship to the environment. And very quickly, that goes to food, and it goes to food production, it goes to comparative medicine, it goes to a new field called eco-health that is out there today. In the interest of time, I'm going to concentrate mainly on this combination of animal health and human health. 1967, we always refer back to what Dr. Stewart said. It was time to close the book on infectious diseases and pay more attention to chronic ailments such as cancer and the heart. At the end of our discussion today, you don't want to make a mockery of that statement because it's a statement I would have, and many of us, most of us would have made at the time, but how wrong that statement would be. Why should you care? All of us will be going back home in about 4 days, and we'll be sitting around talking to our families. Why in the world do we care about these bugs, these germs, these microorganisms, whatever they are, exchanged between human and animal? First, the magnitude is big. Second, it costs a lot, and those costs come back to you. Viruses affect you every day and in ways you may not have thought about. Bioterrorism will likely affect you. It has in the past. Before I get to it, be thinking, how has bioterrorism affected me in the past? And then emerging diseases will reemerge with increasing frequency. First, the magnitude of the problem. 75% of emerging diseases, of new diseases coming out today, are zoonotic. 75%. That's probably enough to say that's why we should care. If you compare them to the non-zoonotic pathogens, the zoonotic pathogens that are out there today are twice as likely to appear in these emerging human illnesses. Scientists today have identified probably less, or this is what the real experts tell me, less or fewer than 1% of all the viruses on the planet today that we've identified and thus in likelihood the number we identify and the number that appear in diseases are going to increase over time. Second, they cost a lot. They cost you a lot. This is a pretty good slide, I think, that summarizes the impact. This, along the x-axis, 1993 to 2005 are the dates, pretty self-explanatory. On the y-axis is the $0 to $50 billion. And this is over time. Foot and mouth disease cost about $30 billion, going from about 1999 to 2003. The SARS insult, we were spared pretty much here, but the insult itself, and it really didn't kill that many people, but look at the huge economic impact. And in there you see avian flu, you see BSE, you see foot and mouth disease, and the real impact is not the details in the slide, but this is costing real money and will continue to cost real money over time. If you add all those up, it's around $100 billion just in the last 10 years. Magnitude is big. A couple of examples, 35-ton gray whale excretes into the oceans every day. 10, I had to hit there on the computer and type it out, 10 to the 13th number of viral particles every day. And that's why some of these cruise ships, probably why some of these cruise ships have these outbreaks of illnesses. Ducks, about several billion avian influenza particles. It's estimated that the more viruses in the oceans than there are stars that you can view with a telescope out there today. So the magnitude is huge. Bioterrorism, end of things, again, sort of why you should care. On this slide, 5 of the 6 Category A agents are listed. These Category A agents are listed by the CDC, but basically our intelligence community gets together, they get together with the CDC, our health experts, and say, is a terrorist or bioterrorist likely to use to have the greatest impact out there? They put 6 agents of these sort of A agents. 5 of those come from animals. The one that's not, I don't list up there, is smallpox, that a bioterrorist is likely to use. And that is not zoonotic in the strictest sense, so that's not on there. But 5 of the 6 are there. It's a good reason to care. Now, why now? Why wasn't this a big problem 10 years ago or 15 years ago or 20 years ago? I implied it a little bit because this world has gotten so small, but there are basically 6 reasons that we can think of, and we should probably go through very quickly why we're seeing these increased epidemics now in the 21st century and why you need to be concerned about it, and I need to be concerned about it, and our policymakers and our scientists do. Number 1, accelerated global trading and tourism. Pathogens as hitchhikers. They go with you. All of us travel now. We all travel globally. 20 years ago, we didn't all travel globally like we do today. Transportation, I'll come to that. The key thing I have in yellow, though, the incubation time of the disease right now, because travel is so quick, you get a virus, you go, you show up, and you can spread that virus, but you don't look sick. And therefore, nobody can put up a shield or put on a mask or stay away. Speed of transportation. Exposure to new pathogens through ecosystem disruption. I'm going to talk about gorillas a little bit here, and what I imply there a little bit is just our population patterns and our marriage and separation from population, whether it's forests or whether it's urban areas or rural areas, and the disruption and impact it has on ecology. The 4th I put down is technical sophistication of food processing. In One Health, I usually talk a lot more about food, and I'd like to hear people talk about that maybe in the discussion period. Number 5, the evolutionary pressures of population. I'll come back to that. Peculiar combination of factors we don't yet fully understand. This is a big one for me, because I've been studying it for about 10 years. Many of you are experts much longer, but I've looked at it as a policymaker and physician, and we don't know very much. A lot of the environmental discussions we're having today are likely feed right into the impact of which viruses emerge, which microorganisms emerge with global warming and which don't, and the why behind that we don't really know quite yet.
A great lecture, sir. Thank you very much indeed. I'm David Nabarro from the World Health Organization. I just wanted to pick up on the conversation at this point of preventing zoonotic disease. What we've been trying to do with regard to bird flu, particularly H5N1, over the last 2 years, using money that's come from the US taxpayer and many other taxpayers, about just over $2.4 billion, is putting, I would say, around 30–35%